As you know, right now, COVID infection is surging around the world and right here in Maine as well. And I do encourage you to do what we're doing tonight, and that is wear your mask whenever you're outside your home. It's an important thing to do, but we'll talk about that and why even more next month. Tonight again we're talking about maximizing your immune system function. Now the immune system, you know, it's interesting, Cheryl just put out a glass of water for me in case I need it. Have you ever tried to drink water through a mask? It's a little difficult, but I don't know how we're going to do that. I guess you lift it up, but I think we can get through without water until the end, hopefully. So the immune system is like the armed forces of our body, and its function is to tell the difference between you and what's not you. And then in the not you category, to be able to differentiate between what's harmful to you and what isn't harmful to you. And in the harmful category, once it's identified the not you that's potentially a threat to you, it needs to destroy that not you harmful section as quickly and as efficiently as possible. Examples of the not you harmful category include things like viruses, like the COVID virus or the influenza virus, bacteria, parasites, fungi, and cancer cells. There are others, of course, but those are the ones we usually think of. And the immune system is what our body uses to keep us from dying. In fact, if your immune system is not intact, or if you don't have an immune system that's functional, your days are numbered. Because within your very body, within the bowel, there are bacteria that if they got outside the bowel and into your blood would kill you very rapidly. And it's your immune system that helps to prevent this from occurring. Remember though that the immune system, like the armed forces, needs to be kept under careful control for several reasons. One, as with any armed forces, when war occurs, there's collateral damage. There's almost always civilian casualties. Even in a very careful precision strike, you have problems with casualties and unintended casualties. And in the body, it's the same thing. When you have an infection, your immune system mounts a response, and there is collateral damage in that response. So the best thing is to avoid the infection in the first place. And the reason for that is inflammation comes whenever the immune system is activated. Inflammation is how the immune system kills bacteria, viruses, etc. But there are side effects to that, and the side effects are inflammation causes chronic disease. In fact, it underlies all chronic disease, whether that's hypertension or diabetes type 2, those or cancer itself. Underlying all of those chronic diseases is inflammation. Heart disease is the same. You have inflammation of the blood vessels, and that underlies the heart disease as well. So while we want an intact immune system and we want an effective immune system, we also want an immune system that can be turned on quickly, and just as quickly when its work is done, you want to be able to turn it off. Often people talk about boosting the immune system. That's great, but you don't want to boost it too much, or else you'll end up with excess inflammation. Now I'd like to talk next about some examples of immune system failure, and so that you can understand the function a little bit better. The first is allergies. Allergies are really a failure of the immune system. What happens is allergens that cause allergies, the allergens are definitely in the not you category, but they are generally not harmful to us. Pollen that floats around in the air, like here in Maine in the spring, pine pollen, it's not going to harm you. It doesn't cause any illness unless you're allergic to the pollen. That is, your immune system sees that pollen as not you and mounts a response against it as if it were going to harm you. Then you get inflammation, you get the runny nose, you get the eyes that itch, you get the difficulty with breathing in some cases, and that's where the immune system is attacking something that's not you, but it really shouldn't. It's not harmful otherwise. So those are allergies. That's one failure of the immune system. Another is autoimmune disease. That's where you have immunity turned against your own body. And there are examples of this that I'm sure you're familiar with. There's psoriasis, the skin condition. There is rheumatoid arthritis that affects the joints, multiple sclerosis, lupus erythematosus, Crohn's disease, and other inflammatory bowel diseases. And diabetes type 1 is also an autoimmune disease. In this case, the body is a little confused. It thinks that part of you is not you and is harmful to you, and it tries to destroy that part of you that isn't harmful, that's a part of you. For instance, it senses that the joint capsule is harmful to you, and the immune system goes about to attack it and destroy it, but then your joints swell up and you get tenderness and painful destruction of your joints. That's rheumatoid arthritis. Psoriatic arthritis, the same. Psoriasis, which is related to psoriatic arthritis, similar. The body, the immune system, goes about destroying your own skin. And that's where you have the immune system confused and thinking that part of you is not you and should be destroyed. Cancer is another immune system failure. In this, the immune system fails to recognize and destroy cells that were once you, but through mutation have become not you and need to be destroyed. And the body is really good at monitoring for these cells that were once you but now aren't, and destroying them. Most of us, they estimate, get cancer several times a day, and the body, the immune system, picks it up, destroys it before it grows. But unfortunately, sometimes that cancer escapes detection as not you and then grows, and that's an immune system failure as well. I'll just mention COVID briefly. It's interesting. This is an immune system failure in a sense as well. As you know, some people get a COVID infection and it's very mild, even without treatment. And if all of us got that type of a response to the viral infection, we would simply view COVID-19 like we do a cold. But because there are a select group of people who get COVID infection and it's very severe, we have now over 200,000 deaths in this country. Now, what goes wrong to shift people from a mild infection to a severe infection? We'll cover that more next time, but generally speaking, it's this. The immune system mounts a response to the infection that is out of proportion to the threat, and the immune response itself endangers you unnecessarily. You might say you have a terrorist cell in our country, going back to the armed forces illustration. You have a terrorist cell in the country. It's a small cell, but the government really wants to get rid of this small group of terrorists. And so it calls in the National Guard, and it calls them in not only from that local area, but from the whole state and the next state and the next one. And you get a whole group of people, maybe 200,000 armed forces, National Guard come in, and they go to kill the people in the small terrorist cell. Maybe there are 2 or 3 of them, but they over-respond, and there's devastation as a result of the armed forces activation. That's really what's happening in the severe cases of COVID, and why it's so important that we have a well-balanced immune system that responds appropriately to infection. So in the armed forces, it goes without saying almost that you have these personnel that are highly trained, and they are very well armed, and they're going out to do battle, and they can do a lot of damage. And it's critically important that for the armed forces, you have a very good command and control system, and that you have a great intelligence system as well to keep the armed forces under control and very effective. And the same is true with the immune system. Every single white blood cell, and white blood cells are the soldiers, if you will, of the immune system. Every single white blood cell has neurochemical receptors on it. That is, white blood cells are under the direct control of the nervous system, specifically the brain. As a result of this, it's really important that we keep our brains functioning well in order that our immune system will function well. And that is often overlooked when we're talking about immune system function, the importance of keeping our brain functioning well as a whole. Next, I'd like to turn to some things that you can do to improve your immune system function. And if you have your handout, that's on the second page, or you can scroll down if you're looking at it on computer. And there are a list of 12 of them, but they overlap, as you'll see as we go through them. The first one that I mention is get adequate rest. And you say, well, what does that have to do with the immune system? Well, back to brain function. If you stay up all night long, and then you try to take a test, say you studied, you were in college, and you crammed all night long, how are you going to perform the next morning? Well, you may do all right, but chances are you won't do as well as if you had studied all along and gotten a good night's sleep the night before your exam. If you stay up for not just one night, but for 36 hours, your brain function just isn't as good. It's more sluggish. And as a result of impaired brain function, your immune system response is not as good either. We know that people that are chronically lacking in adequate rest, whether that's sleep or physical rest, overwork can tire the brain and the immune system as well. Their immune function is not as good. It's not as precise, and it doesn't turn on as quickly, and it doesn't turn off as quickly. So you get missed opportunities to kill invaders, if you will, and you get more inflammation because the immune system doesn't turn off as quickly. Next on the list is eat a high fiber diet. Now, what does fiber have to do with the immune system? Actually, quite a lot. The reason for that is the food that you eat determines the type of bacteria that grow in your colon. And it just so happens that the bacteria that grow in your colon that like fiber produce a short chain fatty acid called butyrate. And butyrate, when it's produced, has the effect on the immune system of quieting it down or reducing inflammation. It does not turn the immune system off, but it's in effect saying, all's well, relax, you don't have to be on high alert, be ready, but not on high alert. So butyrate has been shown to reduce inflammation in the gut and throughout the body as well by down-regulating the immune system and particularly inflammation. So a high-fiber diet helps tune the immune system. The third one, question.
Yes, we have a question. So for a person who's taking an NAC supplement to increase the immune system function during flu seasons, if they're taking that supplement during COVID, how long should one take this supplement, if at all?
That's an excellent question. Unfortunately, NAC has not been studied with COVID, and I'm going to deal with this a little bit more next time. Often you're told, well, eat these foods to boost your immune system, and NAC does boost the immune system, no question. Does it boost it too much so that you're going to have potentially a more severe reaction with COVID? We don't know that. So I wouldn't recommend it yet. I'm not going to say don't take it. I'm simply saying we do not have the information on NAC and COVID. So I would say be thoughtful and be a little careful with that supplement at this point while COVID is rampant, shall we say. The third thing that is important is minimize eating things like you. If we went to the border here, well, let's say we went down to the Mexican border, and you and I were working for the Border Patrol. If everyone coming across the border looked like Martians, you know, they had these little green antennae and big ears, and you know, they were kind of clunky, we would not have any trouble identifying who was an American citizen and who was from Mars. Now, of course, there aren't Martians that we know of, but you've seen TV programs with supposed green little green men, and let's just say that the only one coming across the border were the little green men. There would be very little collateral damage. But on the other hand, if everyone coming up to the border spoke perfect English and dressed just like an American dresses, however that is today, and they looked like an American, they walked like an American, we'd have some collateral damage. We'd probably send people back that we shouldn't and let people in that we shouldn't, and we'd have to be on high alert, and there would be more inflammatory exchanges. This is true in our body too, and there's abundant evidence now that people who eat an omnivorous diet and eat animals like you, now you say, well, wait a minute, what do you mean animals like me? A cow isn't like me. Well, a cow is a lot more like you than a cabbage is. And a pig is actually quite a bit like you and me. In fact, they can use parts of the pig, like pig valves, and transplant them into the human heart. So don't be too offended if I tell you you're more like a pig than a cabbage. There is some, biochemical truth to that. And the more food that we eat that is close to us, the higher alert the immune system has to be, and the more collateral damage there'll be as well. Interestingly, if you draw a blood sample on someone on a standard American diet, their white blood cell count on average will be higher than someone on a plant-based diet. And you say, well, isn't that a good thing? Don't I want more white blood cells? Well, actually, no. That's a measure of inflammation. There are some other measures of inflammation, like C-reactive protein and sedimentation rates. Those also tend to be higher in people on a standard American diet than on a plant-based diet. And those foods don't have fiber in them either, only plants do. And remember, fiber also lowers inflammation. Another thing, number 4, that you can do is avoid eating large amounts of foods that are high in calories and low in antioxidants. These are the refined foods, the sugars, the oils, the animal products, the dairy products. They have, in the animal products particularly, there are little or no antioxidants, and yet they're quite calorically dense. Remember, when you eat food, you have to process it, and then you have to burn it. Wait a minute, burning, inflammation, aren't they related? Yes, of course they are. Burning anything causes inflammation, and that's why the foods that are best for your immune system function are foods that are rich in antioxidants, so when you consume them, process them, and then burn them, they are burned with the least amount of inflammation or oxidation out of place. Antioxidants, if you will, put out the fire that shouldn't be. They allow your body to process the calories, of course, but they keep the surrounding inflammation at a minimum. So eating foods that have large amounts, eating large amounts of foods that are high in calories and low in antioxidants, you want to avoid that. Which means eat foods that are plant-based primarily, and avoiding the concentrated sweets and oils. There's a question?
There is. So what is the impact of the gut biome in allowing or supporting a lot of the diet-based improvements?
Okay, the microbiome in the gut, that's the bacteria in the gut, they change based on the food that you eat. There's lots of talk about the importance of probiotics and prebiotics. Well, the food that you eat is the prebiotic, and the probiotic is simply bacteria. And you can get capsules of probiotics, and you can get probiotics in yogurts. But you know, if you just change your diet, you will change your gut flora. And if you change your gut flora to those that like more fiber in plants, there we're back to butyrate. We'll make more butyrate, we'll have less inflammation, less autoimmune disease, actually quite a bit less on a plant-based diet than on an omnivore standard American diet. For that reason, the microbiome plays a large role in determining the inflammation level in the immune system. Of course, the largest area where you have the largest border, if we go back to the Border Patrol illustration, the largest border or point of entry into your body of foreign substances is in the gut, in the mouth, in the stomach, in the small and large intestine. There's a huge surface area, larger than the skin on the outside of our bodies. So we have a lot of immune cells, white blood cells, lining the gut, monitoring that process, and that's why we want to keep those under close command and control, if you will. All right, going down one more, a sort of a reiteration of number 4 in a way, but a little different twist here. Avoid excess sugar. The original studies on this were done back in the 60s by a gentleman by the name of Sanchez, who I've spoken with. And what he found is that after the consumption of a large amount of sugar, and in his studies what he used was a banana split. He found that after the consumption of a banana split, that it had enough sugar in it that it effectively neutralized the function of white blood cells for about 6 to 8 hours. How did that happen? Those of you that have been to previous Food for Health lectures know that there's a process called glycation, where sugar attaches to protein, and when it attaches, it stiffens the protein and makes it, of course, less flexible. This happens on red blood cells and is the primary mechanism in impairment of blood flow in diabetics, but it also happens on the membrane of white blood cells. And if you have a high sugar intake, that sugar gets out into the tissues, it glycates the membrane of the white blood cells and stiffens it. Now, white blood cells can't move through the tissues as well, and neither can they ingest the bacteria and viral particles as well. So it's effectively like taking an infantryman that has his gun and taking his gun away from him and then hobbling him and then saying, all right, now I want you to go and fight. Can't move as well and has lost his gun. It's not a good thing to do if you have a war in place. So you want to avoid excess sugar, and that will help keep your immune system ready to fight, and it will also keep you from having excess inflammation afterwards, because the sugar, of course, has very little antioxidants in it. Number 6, you want to avoid or minimize alcohol. Why is that? Well, what does alcohol do to the command and control center? If I had just had 3 drinks, would you want to come with a complicated problem to my office to have me work through it? Well, no. Why? Because you know that after 3 drinks, my brain is not going to be working as sharply as if I had had none at all. And that's true with infection as well. If you keep the command and control center working well, the immune system works better as well. And there are quite a few studies looking at immune system function and alcohol consumption, and universally they say avoid excess alcohol. Well, what's that? Well, it depends on your body weight, it depends on how fast the alcohol is absorbed. Generally speaking, less is better. Number 7, just to put it in for fun, choose your parents carefully. Immune system function does have to do to some extent with genetics, particularly in the autoimmune diseases. There are genetic tendencies towards psoriasis or rheumatoid arthritis, and if you have one of these genetic tendencies, it's all the more important that you start early with a careful diet to reduce your risk. Another question.
Yes, how does the brain exert its command and control?
As I mentioned earlier, every single white blood cell has neurochemical receptors on it, and the brain can communicate chemically with those cells. And I'm going to talk about a research article published a few years ago that illustrates this in just a minute. Number 8, this has to do with allergies, as does number 9. Be cleanly as a child, but not too cleanly. Now, as an adult, I want you to be cleanly. But as a child, if they play in the dirt a little bit, it's okay. And don't keep them from having a little bit of gluten and a few nuts and some pets and things like that when they're young. You've heard of people being allergic to cats. Generally speaking, if they're allergic to cats, it's because there were no cats around when they were very little. And generally speaking, if they're allergic to peanuts, it's because peanuts were not introduced to them while they were quite small. We used to think, well, what you have to do is keep them from having any nuts until they reach a certain age. Now we know that it's just the opposite. Introduce them a little bit earlier. What's the optimal time? around 6 months, we think. Breastfeeding is best until about that time. Not cows make milk-based formulas. That increases allergies. But breast milk till about 6 months, and around 6 months when they start to get their teeth, introduce them to some gluten and some peanuts and other foods that are often problems with allergies. That's because the immune system is just developing then, and if you introduce those substances, then the body says, well, I guess these aren't harmful, and you don't develop the allergies.
But if you're going to give a little one peanuts,
Oh yeah, do not give peanuts to children whole, because they can aspirate those, clog the windpipe, you're in real trouble. If you're going to give nuts to a baby, it has to be 6 months ideally, and in the form of nut butter. I don't want anybody giving a newborn or a 6-month-old full whole nuts. I'd be in trouble then, and so would you. So if you have grandchildren, none of that. All right, number 10, think happy thoughts. Well, why? Well, because there was a study that showed they took, and those of you that have taken our lifestyle choices class remember this study. They took a group of people and they said, we want you to think back to a time in your life when you felt really used and hurt. And it was just a really bad time. And we want you to get into that and relive that. Don't do this. Relive that bad experience for 5 minutes. Now, before they did that, they measured their salivary IgA. IgA is an immunoglobulin. It's like a tag that tags invaders, and once tagged with an antibody, you're tagged for destruction. IgA is found in the nasal secretions, it's found in the tears, it's found in the GI tract. It's one of the first lines of defense against infection. And they measured their IgA levels, they had them relive this really bad experience, and they found their IgA levels dropped by 70% and didn't return to normal for 5 hours. Now, how did that happen? Well, the brain is thinking negative, down thoughts. It's in control of the immune system, it's not doing a good job, and it lets its guard down. Interestingly, many people, the vast majority of people that get cancer, if you go back in their history, the year or two before the diagnosis was they had a bad, stressful time in their life. And it really adversely affected them. And then the immune system was depressed and cancer escaped immune system detection. But don't despair. They took the same people on another day and said, now we want you to think back to a time in your life when you felt really loved and cared for, and it was just a warm, lovely time. And we want you to relive that experience. And they found that their immune system improved, and the IgA levels went up, and they went up by 80% and did not trend back down for 5 hours. And so the thoughts that you think not only help your brain to be happy and you to be a better, well, I don't know about better, but easier to live with person, but they also affect your immune system directly. Now you say, well, maybe if I think too many happy thoughts, my immune system will be on high alert and I'll have inflammation. No, these are immunoglobulin levels. They have to do with detection of disease, but not activation. So it's a win-win. Take the time to think those happy thoughts. Number 11, eat colorful fruits and vegetables. We've also already looked at this, but there's some fascinating studies with vaccine and immune response to vaccine. They took people and gave them, half of them, a serving of kale for several days prior to their flu vaccine, and found a markedly improved antibody response when they give the vaccine. This has been shown with other greens as well, and many colorful foods. Another study that I find fascinating is a blueberry study. where they measured the NK cell. The NK is a natural killer cell. It's a type of lymphocyte. It's like the special forces, the Navy SEALs of the body. And you want those very active. They're quiet. They glide through the body looking for particularly cancer cells or other invaders, and they're very good at seeking them out and killing them with minimal inflammation. And they found that the NK cell response was doubled after several days of a good blueberry intake. How much? About half a cup a day seemed to really boost the NK cell activity. Another, this is number 12 finally, another food group that's very helpful for immune response is the Allium family. Allium includes garlic and onions and shallots and those foods. And they're very interesting because they increase immune system response and decrease inflammation. So it's the best of both worlds. Garlic is particularly helpful at this. So if you put that to work, I think you can maximize your immune system function, and then we hope you'll avoid not only the flu, but if you get COVID, hopefully you won't, but if you do, that your immune response won't be exaggerated and you'll avoid a severe case. Any questions?
What about turmeric supplements?
Turmeric is another one that is very good at reducing inflammation but does not depress the immune system. Again, the antioxidants follow color, and the bright, colorful foods are great. Sweet potatoes are similar. Flax is a seed that is rich in antioxidants, and that's good for immune system function. Generally speaking, colorful fruits and vegetables, seeds and nuts are very helpful.
Okay, do we have any more questions? Do you recommend pea protein in shakes or another type of protein powder?
I don't recommend protein powder unless you're protein calorie deficient. I have several patients who have a protein losing enteropathy, and I recommend that they take pea protein or another type of protein supplement. But in the normal gut, we do not need to take extra protein. Even if you're on a strict plant-based diet, extra protein is not what you need. Excess protein, particularly of an animal source, but also of a plant source in a refined form, can cause problems with osteoporosis, and it can be hard on the kidneys. It's interesting, if you eat carbohydrate calories that you don't need today, you store it. If you eat fat calories that you don't need today, you store it. If you eat protein calories you don't need today, you excrete it. And you excrete it through the kidneys. It forms an acid, uric acid, that has to be buffered with calcium, and so you can be hard on your bones if you eat excess protein, and it's just not good. It can raise your blood pressure. You do need to get adequate protein, but getting adequate protein is really easy, even on a strict plant-based diet, if you eat a wide variety of foods, including grains and legumes, and greens are actually high in protein as well.
Okay. What about if you minimize gluten intake? Will you develop an increased resistance to gluten?
Gluten it's gotten a lot of bad press. It's actually a very good protein, and it's not a problem to consume gluten unless you have celiac disease or an allergy to gluten, which is actually not that common, although I will say my father had celiac disease and my son has it, and so it does happen. What I find is most people that think they're gluten intolerant are actually not, but they're intolerant of glyphosate. Glyphosate is a chemical found in Roundup, and it disturbs the gut microbiome, and they'll get GI upset when they eat a grain that is grown with glyphosate. And often people that think they're gluten intolerant, if they switch to organic grains, do much better.
So the same question with sugar and dairy reduction. Do you develop a sensitivity to that in the future?
No, you don't. Other than to say if you eat less sugar and more fiber, you're going to probably live longer. But if you haven't had any sugar for a long time and then you have a big walloping dose of it, it will have more effect than if you're eating sugar all the time. That's true of any, well, it's true of alcohol, for instance. Alcohol is a refined carbohydrate, and in people who drink alcohol every day, starting early, going late, they develop a tolerance for it, which I would not have, as I'm not a drinker, and if you sat me down and gave me 2 drinks, I'd be under the table because my system isn't set up for processing that. Your body adapts to some extent to the foods you eat. That's true with fiber too. Any of you that suddenly ramp up your fiber intake, you're going to have GI distress. You're going to have gas and you're going to think, I don't want to do this, I feel so bad. It's important to remember that if you increase your fiber intake, it takes about 2 weeks to change your gut microbiome so that the bacteria that like to digest it can grow and digest it. So you don't want to change your diet radically too quickly. We saw this in our Lifestyle Choices program that we ran for 20 years. The first week, people would come in, oh, I don't know if I feel so good, I've got a lot of gas, and by the end of the second week, they were saying, I haven't felt this good in 20 years, because they had already shifted their gut microbiome. So it happens.
Absolutely. We've already talked a fair bit about turmeric, but there is a specific question about turmeric pills, the actual supplements.
So the only thing I would say about turmeric is this: get the whole thing. If it's in a pill, I don't mind, but I wouldn't go for curcumin, which is extracted from turmeric, because the other compounds in the root are helpful as well. So if you're going to have turmeric, have the whole thing, not just something that someone's extracted and tried to sell to you for more that isn't as helpful in any case.
Okay, are there any other questions? Speak now or forever hold your peace.
Well, you don't have to hold your peace forever. You can go out and vote, but be peaceful about it.
Okay, here comes one. I always feel better when I'm taking oil of oregano capsules. Do you recommend limiting how often or how long these are taken?
If you feel better doing it, I certainly don't mind. I would say instead eat oregano, because when you extract the oil and it removes some of the antioxidants and some of the fiber, and so it's going to oxidize more quickly, I'd say go for oregano instead. But I have no problem with you having oregano, the more the better. In fact, herbs are some of the most powerful antioxidants, and whether that's oregano or thyme or any of the other herbs, parsley, you name it, those are wonderful for you.
And all of those things can be grown here in Maine. So even if you live in an apartment and you don't have, dirt, a backyard or whatever, throw it in a pot on your porch.
Or under lights or in your windowsill, you can grow a lot of those herbs, and they have a lot better flavor when they're fresh.